So let us study the subject of eruption today. This is a new topic. This is quite related to shedding. So the term eruption means to impair, meaning to break out. It is actually a way, it has been derived from this word impair because the tooth is breaking the oral mucosa and coming out. So if I want to define eruption, it is defined as the physiological movement or the process by which a tooth moves from its developmental position in the jaw to its functional position in the occlusal plane. What do we mean by this? By this, if we look at the terms, if we break the definition up, we say first it's a physiological process, meaning you cannot cause eruption, you cannot create eruption. It will happen naturally. So it is a process of axial or occlusal movement, meaning the tooth will always move upwards from its developmental position in the jaw, meaning where the tooth developed, from that position it will always move occlusally till it reaches its functional position in the occlusal plane, meaning the tooth has to reach its antagonist, meet the opposing tooth in the occlusal plane. Only then we call it as eruption. This eruption is also a continuous process. And why is that so? Because your jaws grow, the teeth shift. So you eat food, the tooth abrades and attreats, and had the tooth not erupted continuously, there would have been a gap created between the upper and the lower teeth. In order to prevent this from happening, eruption becomes a continuous process where the tooth will continue to erupt all through life, trying to maintain contact with the antagonist. So why is it so important to maintain this contact with the antagonist? Because how are you going to chew? The antagonist acts as an occlusal stop, meaning it will tell the tooth that only till here you are supposed to grow, not beyond this. And that is how your masticatory line is maintained. So your occlusal table is maintained intact. The phases of tooth eruption can be categorized into three main important stages: the pre-eruptive stages, the eruptive phase, and the post-eruptive phase. Now the pre-eruptive, as the name is suggesting, it indicates all the movements that will happen before actual eruption begins. So what is actual eruption? Movement of the tooth from its developmental position in the jaws to its functional position in the occlusal plane. That is eruption. So all the movements that happen in the developing tooth before this process of eruption, that is called as pre-eruption phase. So these pre-eruption phase includes all the movements that are done by the tooth germ, by the developing tooth, as in the bud stage, cap stage, early bell stage, advanced bell stage, but before the tooth begins eruption. The eruptive phase or the eruption phase begins with the initiation of root formation. Now once the crown is complete and the root begins to form, there is a pressure. The downward growth of the root actually tells the tooth that it is supposed to start erupting, so that more space is created for the new root to grow. So this root eruption or root formation is what many times is considered as a triggering factor for eruption. But remember, root formation is not essential for eruption. Though it does play a very important role in eruption, you cannot say that it is only because of root formation that eruption will happen. The third phase is called as the post-eruptive phase. This happens after the actual process of eruption is over. That is, the movement of the developing tooth from its developmental position in the jaw to the functional position in the occlusal plane. Now, once the tooth has achieved that position in the occlusal plane, whatever movements happen after this, they are called as post-eruptive movements. So it is this post-eruptive movement what is responsible for maintaining the teeth in their occlusal plane. So like I told you, when you chew, the teeth grind off and a space would be created. This space created is prevented from developing by the post-eruptive tooth movements.